everybody, it's Friday. It's Friday, August the 14th. I can't believe it's the middle of August. I have been at home now, more or less. Uh, more or less since March the 15th. That's 5 months. And we've all been wrestling with this coronavirus for, yeah, 5 months. It's been a long haul, but we're still here. So I'm going to be quick today. There's several things to touch base on, but the most important thing is Community Health Center Week. Community Health Center Week is coming to a close, but it's been a fun week. I've seen a lot of participation, and there's been a lot of fun going on. You had sports Tuesday, where everybody shared their favorite sports theme with their t-shirts. And then we had Throwback Thursday, and today we are Care South Carolina Strong. And I'm sure most everybody by now has had the meals at your various offices and some other little goodies and the sanitizers, little hand sanitizers that I really appreciate. I really needed this. So, and of course, the little flashlights. Now, I've got to be honest with you, it took me a little bit of time to figure out what that thing was. Um, okay, it took my stepson, who was 20 years old, to tell me what it was. But it'll sure come in handy. It's an LED, and so what a very neat thing. So it's been a good community health center week. It's community health center week during a pandemic, something new. We did an awful lot of things virtually, but it was still a very important time because really and truly, community health centers and especially Care South Carolina, we are indeed lighting the way uh, as not only community health centers across the nation, which we are, by the way, 1,400 strong across the nation. FQHC's community health centers serve over 30 million patients. We are truly the largest healthcare network in the nation. And as community health centers, we also provided 8.2 million tests at Care South Carolina through July. We provided 2.2% of the entire state test. Considering that we're not a very large organization when you compare us to some of the big entities like Prisma and other MUSC and other entities, 2.2% is an awful lot of testing. So we're really proud to be part of a network that is held in such high esteem and means so much to our communities. Speaking of testing, a little bit of different things are going on. You might be very aware that we have changed our promotion or our the way we roll out testing. In the beginning, our testing was literally free. Um, Now, as we enter into the fifth month of this, we really can't sustain completely free testing. We devote a lot of staff and a lot of resources. So we want to do what would be financially prudent, and that is where any third parties would pay for testing, we're going to bill. Now, if we are making sure that there will be no additional cost to the person who is getting tested. So if, for instance, the insurance company says, well, we're not going to pay for anything, it'll still be at no cost to the person getting tested. But we're going to make every effort to recoup what revenue that we can and collect insurance information where we can. And the folks that are doing testing are telling me that really patients are understanding this. They're understanding that, now this thing has gone on for quite a while, and we put a lot of resources in it. resources that initially were helped being paid for either through a HRSA grant or some other resource, but now things are running down, so we have to be good stewards. We don't want to decrease our testing, but that is why we are really collecting insurance. But that is why we have also made the decision that it will be at no additional cost to the person being tested. So if there's a co-insurance or for some reason the insurance doesn't want to pay, we're still not going to go back and ask the patient for anything. So I wanted to make sure that everyone is aware of and understands our reason for doing that. Also, if you are happen to be following the DHEC data, they recently posted a very interesting piece of data, and they said that in communities that they were able to track, and they can do so by zip code, that they were finding that communities that had implement a masking ordinance requiring masks, that there was a 4.3% decrease in the cases. That's pretty significant. So we really want to stress once again the importance of masking. We only have one community in our entire service area that has passed such an ordinance of requirement of masking in public, and that is Hartsville. So kudos to Hartsville also. We appreciate Hartsville being very attentive and aware to the benefits that masking brings. Also, in the area of testing, I would be remiss without giving kudos to our Mobies. We now have delivery of two of them. Our third one will be coming sometime next week, and we have deployed them. They've been out in the field. We are using them just as we intended to. We're trying to find smaller settings where we don't need to be testing hundreds of people. Settings like churches, towns are interested in us coming out. We actually did something in Lynchburg. If you hear of anything or know of any entity that would be interested, coordinate that with Randy Carlisle, because we will be taking delivery of our third Moby. So we want to make sure that these entities are out and are being used for good purposes. You know, flu season is not that far away. And the folks at the CDC, the Department of Health, and other medical specialists are very, very worried about this flu season. The flu could mask symptoms of the coronavirus. Also, it could possibly make the coronavirus, if a person gets it, could make it much more, who shall I say, sick for that individual. So we're really worried about the flu season. We don't know exactly what to expect, but what this coronavirus has told us, frankly, is to expect the worst. We're seeing a lot of side effects even after someone is no longer sick with the virus, but are still experiencing a lot of side effects. So this is an unknown territory, so to speak. And we're worried. We're worried about the flu. We're worried about the strep that we often see in the upcoming months. We're worried about the upper respiratory conditions. So be very mindful. Encourage all of your friends and your neighbors to get the flu vaccine, to get the pneumonia vaccine if they are eligible for it. To be very mindful that this could cause complications with the coronavirus. We have no intentions of uh, changing our mandate at CARE South Carolina for employees to get the flu vaccine. If anything, it will be more important. So, fall is upon us, and right on the heels of fall comes a tough winter. It's right around the corner. Let's get ourselves ready. And of course, with fall, we are dealing with back to school. I have spoken about this now in my last two weekly messages, and I am speaking about it again. I know that many of y'all are between a rock and a hard spot. I know that many of y'all have raised questions about whether or not, when you are home attending to the needs of your family, kids going back to school or so forth, whether or not the Family's First Act could not be applied to us. Unfortunately, the Family First Act did not apply to CARE South Carolina. An organization had to be less than 500 employees, and we are not less than 500 employees, so we could not become eligible for that. It's one of those situations, for that same reason, because we had over 500 employees, we could not qualify for that very good benefit that was called the Payroll Protection Plan, the PPP, as we've been calling it, out of the Small Business Administration, the SBA. So we lost out on several benefits due to our size. So I really regret that. We are doing everything in our power. We are ramping up telehealth as quick as we can. We are ramping up other services and are hoping to be able to minimize the impact that this return to school is going to take. Not a good solution, I know, and probably not what many of you wanted to hear. But right now, it's just about our only option. I'm not going to spend a lot of time with this message today. I want to remind everybody that we continue tomorrow with some more back to school events. We will be having a back to school event in Dillon at the high school there. It's a back to school bash. We give out a lot of things that kids need, whether or not they are going to school virtually or whether or not they will be attending in person. In Hartsville also, the Malloy family sponsors a very important back to school bash, which we will be helping sponsor and chipping in with resources. So there's still going to be a lot going on in terms of things that CARE South will be participating in. I'm hoping that in the next couple of weeks also we can be sharing with you and rolling out a brand new website. We'll see. We've been working hard on it, and maybe there'll be some new things to be introduced. So, as I close out today, I remind everybody that we are indeed, as our t shirts say, here South Carolina strong. And we're strong because of you, because of what you do, what you care, and what a difference you make. And that very strength has been embodied by two awardees of the South Carolina Primary Health Care Association Clinical Retreat Virtual when they awarded Tracy Thigpen, our Chief Nursing Officer, and Kelly Cross, who works in our population health team, awards for the Nurse of the Year and the champion of performance improvement, or I think it's population redesign, or the title I can't quite remember. But these are two very special staff at CARE South, and they were truly surprised with their award. So if you haven't congratulated them, please do so. They have earned every bit of it, dealing with so many issues over the past year. Thank you all again for what you do. Remain CARE South Carolina strong, and as the weekend approaches, stay safe. Wear your mask when you're out there. We want to see you back on Monday. Bye bye.